morning. I'm Renee Cohn hanging out with you on San Diego Living. Hey, is it allergies or could something maybe be worse making your eyes water? Well, an expert tells us to ditch the drops and when to see a doctor. That's when San Diego Living comes right back. Welcome back. Red, itchy eyes don't always need Visine. Philip Smith, our spokesdoctor for the California Optometric Association, says the eyes don't have it when it comes to self-diagnosis. And common mistakes that we can make, they're very common, and I think it's really hard sometimes to tell, do we have allergies or is something else going on?
Yeah, it's very common. Matter of fact, parents, if their child has red, itchy looking eyes, sometimes we want to make sure they differentiate between an allergy and a bacterial or viral infection.
Yeah.
Because that's real important.
Well, we're so glad you're here today to clear this up, but I have to say, you don't have any allergies.
Very lucky.
Do your patients just look at you and shake their head?
Well, not really, but they do come to me with a lot of distress, and we try to help them with that.
Good. Well, and you brought some things today that we have on our table, because I know the first thing a lot of people think of, gosh, I have, itchy eyes, maybe allergies, and you go and you buy these products, and you're saying that, that's not always the best thing that you want to do.
Probably one of the first things a parent can do if their children or if they have allergies is just rinse out their eyes a lot with, we have a bottle in the center here of the just saline solution, just regular saline solution. The more you rinse, the more you get the allergies and the pollens out of the eye, the better the eyes are going to feel.
And what is in saline?
Just salt water, just like your normal tears.
That's awesome. So that you just put that in and it can get a lot of the irritants out?
Out, that's correct.
Okay. Now, when we're talking about if it's allergies, of course, sometimes it's hard to decipher, but you're saying that there are specific signs and symptoms that would point in that direction.
Right. Again, either a parent or for themselves or for their children, if their eyes are real itchy and they get this kind of stringy discharge and they have moderate tearing and they have lots of itching, that's probably an allergy type of an eye.
Allergies, of course, we've been hearing about, they can come on at any age, they can go away, they can last a lifetime, no real rhyme or reason.
Yes, it really can happen at any age, and especially here in San Diego we have a lot of pollens and things, and so people are more prone to them.
Okay, so if people don't fall into that category, maybe it could be more of a bacterial situation.
Bacterial or a viral infection, and need to be aware of that because, especially with viral infections, they have a much longer incubation period and they can actually be very contagious and can last up to 21 days.
Okay, so some of the signs and the symptoms for viral are different than the allergic symptoms.
Absolutely. The eyes feel, instead of feeling kind of itchy, they're kind of feeling gritty, a lot more
almost
watering.
Like sand is in them?
Sand is in the eye, that is correct. Itching is really minimal with this, so it is mainly a watery, gritty feeling eye, and it can last 2 to 3 weeks, and the important thing is to keep, if this is the problem, then you need to keep that child away from touching and getting in contact with other people because it's very contagious.
Would pink eye fall into this category?
Yeah, that's a bacterial infection.
Bacterial,
yes.
Which leads us to our next subject.
Yes. Yeah, when you have a bacterial infection, again, that's something that can be solved with just a very nice antibiotic, and it is covered very quickly in 2 to 3 days. Child's out of, there's no concern after that period of time, and then go back to school very quickly.
Great. For
versus the viral.
For the bacteria,
yes.
one of the things that's the same is that gritty feeling with the sand in your eye. So
correct.
that and the viral, that can be a little confusing.
That is correct. But again, with the bacterial, as you can see here, the discharge is a lot more, I call it goopy. A lot of goopiness coming out of the eyes, and that's really probably the more common, would be a bacterial infection for a child especially.
Okay, and that one you said that it clears up more quickly. It's the viral that can leave a kid out of school for a pretty good amount of time.
2 to 3 weeks.
Wow.
Yeah.
Anything that we can do, doctor, to prevent this from happening?
Well, in terms of allergies, not a whole lot. Bacterial, as you've been hearing on the news recently in terms of the infections and things, a lot of washing the hands and stuff, just keeping everything nice and clean, especially with kids.
Yeah, so that's very, very important.
Very important.
What about, when kids, they play in the sand, they play in the dirt, and then we rub our eyes? I mean, you can't always tell kids not to do that, but what can we do to keep our kids less likely from getting this?
Probably just, again, washing their hands as soon as they come in from playtime and try to keep them away from their eyes.
Okay, yeah. And again, so you brought some of these medicines that are over the counter. And what you're saying is, you know, try the saline first, and then maybe you could go for some of the other ointments.
Prescriptives, we have a little bit of a steroid drop here that sometimes has to be prescribed. Pataday is a very common one for allergies that is prescriptive. But try the simple things first, the saline, rinses, and also cold compresses.
Cold oh,
yeah.
Good idea.
If the eyes are feeling real itchy and stuff, just some ice in a washcloth, put it on the child's eyes.
Great. Thank you so much for joining us today, and
Sure.
you are so lucky you don't have allergies.
I
hope it stays
you.
that way.
Okay.
More information, just log on to our website at san diego6.com.